Let's now take you to Klerksdorp, where 11 children in the northwest born with facial deformities will receive corrective surgery in Tshepong Hospital. The reconstructive surgeries will be conducted this week until Friday as the Smile campaign. Newzroom Afrika's Refiloe Seboko joins us live with some developments. Refiloe, a very good morning to you. The road to restoration and perhaps working on restoring self-esteem is set to get underway. Talk to us about this.
Most definitely, those are some of the points that were highlighted as the briefing has just happened here. The Smile Foundation, together with the Department of Health in the Northwest Province, coming together to make sure that 11 children here in Klerksdorp, Tshepong, are getting those surgeries done. But allow me to welcome MEC Madoda Sambatha to tell us more about this Smile campaign that is happening. First time we heard MEC coming to the Northwest Province.
Thank you very much. The reason is for the first time we now have an agreement with Smile Foundation to jointly coordinate and ensure that the campaign yields better results on the numbers. We did have last year 2 that we did because we already have a specialist responsible for that. At the center of the campaign is that we help kids who have been born with these open deformities on the basis that we help them regain their own confidence, but also help them both in terms of ability to eat proper and ability to speak. And this is done as a basis that it is not a permanent feature. And we call on our people, all of them in their numbers who have those kids that have these deformities, to come forth to health facilities, declare them, and then ourselves and Smile Foundation, even ourselves on our own on daily basis, will ensure that this intervention is done. This one is done with 11 on the basis that our partnership with Smile Foundation gives us strength on the numbers. And on normal circumstances, we do a very minimal number because of challenges of resources. What we're doing is because this is both physical and emotional intervention. Physical on the fact that a gap you had yesterday, it's closed today, tomorrow you are released, go home. Emotional on the basis that all the frustrations you had yesterday, including the community torture on the basis of what you have from birth, it's now something of the past. You regain the face equal to any other person. In actual fact, in the hospital, we even have a specialist who's dealing with facial reconstruction. First, for medical reasons, but secondly, for reasons of beauty, that those that want to change their faces can do it. But for those ones, they pay.
Let me check Ngwenya. Thank you so much, MEC Madoda Sambatha, to find out Ngwenya, 11 in the northwest, but you said that you have been able to reach over 5,000 children, if I got that number well. Thank you so much and welcome to Newzroom Afrika. Tell us about the Smile Foundation and how has it been going in other provinces?
Thank you so much. Smile Foundation has been able to assist 5,066 children across South Africa. We are functioning in 7 provinces across South Africa. We partner with 17 academic hospitals in the country to assist these children. We provide them with psychosocial support through our program called Clef Friends and You Matter. We support children that need all kinds of craniofacial reconstructive surgery, together with children that are survivors of burns. And with partnerships with the various departments of health in the various provinces and the hospitals that we work with, we ensure that the services are augmented and that Smile will be able to assist make those smiles possible.
You had touched on, during your briefing earlier, on some of the challenges that these children are having because of these surgeries that needs to be done.
When a child is born with a cleft lip or palate, they cannot drink any milk. And we then provide the children with bottles where they are especially able to drink the milk through. If the child does not get the surgery early in life, they are unable to speak, they are unable to eat. So the child's going to become malnourished and they're not going to be able to live fulfilled lives. So we are able to support them to make sure that they get the support from the time that they're born right until they decide they no longer need our assistance, to ensure that they live fulfilled lives and they become productive members of society.
Thank you so much, Ngwenya. Allow me, Mpho, maybe let me go back to MEC Madoda Sambatha. MEC, there was an issue of backlog that was also raised in the province. How is that going to be addressed in making sure that these surgeries are being done, there's no backlog, and also families that has children that needs to have surgeries come forth?
Our backlog as a province is in twofold. One, it's a normal backlog caused by COVID because many surgery performances were not done during that time. Secondly, it's a backlog on the basis that we previously did not have a specialist in the province. So we're referring to Gauteng for the service. Now that we have an agreement and a partnership with Smile Foundation, the backlog is going to be dealt with properly. Now that we have our own specialist based here, the backlog is going to be attended to. As we speak, when we take 11 at a go, it means the backlog is going to be released. My worry is not the backlog. My worry is the ones who are kept in enclosures in communities, not brought back, so that we put them in the list and then deal with a holistic number that is actual. For now, we're dealing with those that come and few numbers and those that are discovered by health practitioners. We're calling to community to come up with those kids. We are there for them, both the department and Smile Foundation.
Are you also there for them when we are looking at issues of post-operations?
We are there for them, for everything. Once done, as Smile Foundation was explaining, there's a process of follow-up, check-up, and ensure that there's an element of continuous encouragement and building confidence on them to believe in themselves as the gaps would have been closed.
Let me go back to Ngwenya, Mpho. How do families, in the country, access the information that they need to use in terms of accessing Smile Foundation and put together with departments to get help?
They can go onto our website, which is www.smilefoundationsa.org, and we would be able to provide them with whatever kind of support they would need. There's just a click-through page there where they can send their information to us, and we will contact them to assist them in any way that they need.
Thank you so much for your time. Mpho, let's leave it there for now because there's still more that needs to be done. We were just on a 10-minute break, in fact, just before you came to us, the MEC, together with different stakeholders that are here, Smile Foundation that are here, the parents that will be here. There will also be a walkabout that will be done. And hopefully we'll also be able to chat with some of the parents to those children to find out some of their challenges that they've had and how they would like to be assisted.
Very well, Refiloe, Seboko. We leave it there for now.